So now we're going to be talking about what is chemically going on, like hormonally, in your body, and some of the root causes of why you might be feeling the way you are. So just to recap, this is what's happening to your hormones during pregnancy. This look at the 40-week mark where it says birth. You see this huge surge in oxytocin. You see a slight bump up in cortisol, which honestly, I think this isn't a great depiction of how high your cortisol can spike. Then you see prolactin higher. We already talked about that, how prolactin helps with milk production and oxytocin helps with the labor process. But you see this huge surge in hormones and then immediate drop, which is why you're feeling depleted. So let's talk more about cortisol. We've talked about it a bit already. So really, fetal stress of the baby, that basically the baby is also secreting cortisol, which causes the start of contractions, right? And then the mom also has stress going on, and then that helps the body with dealing with the stress and pain during labor. It also basically helps with the expulsion of the baby and then the placenta post childbirth. And also, we didn't talk about this, but cortisol plays a role in fetal lung maturation. So surfactant is a substance that helps the lungs expand and function properly after birth, and cortisol helps the production of that. And so then why do we keep talking about cortisol? So let's talk about what it does in our body outside of this, pregnancy process and then birth process. So cortisol is our body's main stress hormone. So every time we get up from sitting to standing, or we go exercise, or we're having caffeine, or we have something that's like inflammatory for our bodies, alcohol, whatever, maybe you're taking some other sort of stimulant, also just to get your heart pumping and to elevate your blood sugar levels, to push more glucose into your muscles to be utilized for energy. Cortisol is really just a part of everyday life, and we need it in order to function. So as I just stated, cortisol levels rise to help mobilize energy stores, so that's that glucose production, increases heart rate and blood pressure, and enhances alertness, preparing the body for a fight or flight response. So a lot of times too, when you see someone who's having too high of cortisol, their pupils will actually dilate because they need to see better in order to run away from something. This is why we have an increase in blood glucose, because like I said, it pushes it to the muscles so that you can run away from something. So really this is our survival, I'd say, hormone. We'll talk about other ones that play a role in this, but it's a huge part of the anti-inflammatory process. It's a pro-inflammatory hormone until you get an excess of it. So pro means it's good and something that we need, and then also plays a huge role in immune function. So let's talk about this pathway. So when we have a perceived stress or a real stress, and I gave some examples of, maybe we're drinking a stimulant or we're having something else, or, people who take Adderall consistently, that is absolutely firing up this pathway more than we would like. So your body gets a stress response. Your hypothalamus is a gland inside your brain. Here, I'll show you a photo. So you see that right there in the middle, essentially. So that gets a signal, a hormone signal from the body that something needs to happen. And then hypothalamus secretes something called CRH to then go fire up the pituitary gland. And then the pituitary gland secretes something called ACTH, which then gets sent to the adrenal glands. And then the adrenal glands secrete whatever hormones need to be produced at that time. And so in a healthy system, you have these responses all the time. Like if I get up from my chair right now, I should have a healthy level of cortisol, adrenaline, epinephrine released, even aldosterone released. We'll talk about that in a second. And then my body should regulate itself. My body gets signals from the body saying, hey, our blood sugar levels have gone up now from this secretion of cortisol. So now we're going to send less hormone signals to the hypothalamus to make more of that. Okay, this is true for really how any of the hormones work in the body. There should be this nice feedback system. And so that's why things like medications and birth control can get in the way of these feedback loops, because you're getting a synthetic version of something that's telling your brain, oh, we don't need to make this on our own because we're getting this version that may not actually be what your body needs. So it kind of messes with that. And that's why people have issues sometimes on those medications. So, like I mentioned, this hormone pathway is firing without us even having to think about it. Same with other hormone pathways. We don't have to tell our brains, okay, make more estrogen. I need more progesterone. Make more testosterone. Oh, I need more cortisol. You don't have to do that. Your body should be able to do that itself. Sometimes we need help getting that to regulate, which is what we're going to be talking about. But this should be happening automatically. So with symptoms of postpartum, this pathway is typically always involved because of that high amount of stress that you have during childbirth. And then, like I said, that depletion. So this is where then sometimes that feedback or those hormone signalings get all out of whack because your body can't keep up with those demands, right? So let's talk about the other hormones that your adrenal glands produce, because this will help you better understand your symptoms. So cortisol, we've already talked about that. That's our main stress hormone. Then we have adrenaline, or also known as epinephrine. That helps send more blood to the heart and muscles for energy. Noradrenaline or norepinephrine dilates the blood vessels so that we can push that blood to the heart and to the muscles. And then aldosterone helps regulate your salt. So sometimes when people are having too high of cortisol, then aldosterone is also higher. And that can cause the fluid retention or swelling that I see a lot in patients. And then DHEA is a precursor for other sex hormones like testosterone, estrogen. And sometimes, once again, typically DHEA is going to be secreted less when there's excess cortisol. So we'll talk about that in a second. Okay, so why do we care about dysregulation of this pathway? I've already kind of mentioned, so when you have that huge surge of hormones and that drop, you can't ignore this HPA pathway because it's just so heavily involved in it. So you can't ignore it thinking that you don't need to consider treatment for that if you're struggling. So symptoms of this pathway being dysregulated are fatigue or extreme fatigue, like I don't want to get out of bed, difficulty sleeping or insomnia, cravings for sweet or salty foods, weight changes, that could be weight loss or weight gain, digestive issues, maybe you're not absorbing things well, you have constant bloating, maybe you switch between diarrhea and constipation, you might have a lower blood pressure. This is typically when you're in that depleted state, but it also can show up as high blood pressure because, like we just talked about, when we have our adrenal glands being fired initially in more of like an acute phase, not when they're fired up for a long time, you'll get this rise in blood pressure because you have more aldosterone being secreted as well, and you need your blood pressure to elevate slightly for you to be ready for action. So mood disturbances, this typically happens when you're more in the bottomed out phase. Anxiety is when you are having the initial acute phases or acute responses and secreting more cortisol, but then later when you're just so irritable and depressed, it's typically more depleted. We will talk more about that. Muscle or joint pain, decreased immunity, we'll talk more about these too. Hormone imbalances, so maybe you don't get your periods, maybe your periods come whenever and they are a surprise to you. And think prior to even getting pregnant, how your hormone cycles were before, then decreased libido, obviously, and then changes in hair growth patterns. So let's talk about this. Remember I was saying how if you have more cortisol being secreted, this hormone DHEA, you see that on the right-hand side under pregnenolone, sometimes won't get created as much. So the reason for this is because I was saying this earlier, cortisol I like to think of in our adrenal glands are basically our survival. It's like our survival gland, and cortisol is something that helps us survive along with those other hormones. DHA less, not so much, and same with aldosterone, but cortisol, adrenaline, epinephrine. So when we feel like we're in this constant state of stress, so you just gave birth, your hormones were high, now you're not sleeping, your baby's crying, life happens, and we don't know how to regulate, then your body thinks, oh my gosh, like we are really under attack here, and we need to secrete more cortisol in order to help ourselves survive. So this hormone, so you have cholesterol is like the precursor to making all hormones, which is why getting healthy fats in are good. Then you have something called pregnenolone, and pregnenolone can get immediately made into cortisol and pushed more this pathway versus going to the DHEA pathway where you get estrogen, progesterone, testosterone, all those things. So, and this is another reason why you're going to have lower libido, why you're getting these hormone imbalances. A lot of times it actually has to deal with this overfiring of this HPA pathway that's screwing up your hormone production. That should naturally be happening. Remember how I was talking about that feedback loop? Your body should be having this nice, healthy, normal feedback loop to create the healthy amount of hormones that it should. And a lot of times it doesn't happen when we're overfiring this pathway.